Hi, I'm Dr. BradDibble from PACE Cardiology. Today I wanted to address something that happens a lot in our office with patients who come to see us. Frequently we're asked to see patients who absolutely have no symptoms and so far no known heart concerns. But they get concerned because maybe a family member or a friend has had a heart attack and they had no warning, and so then these patients start to be concerned, what's my risk of this? Might I have a heart attack without any warning? So there's a lot of ways we can look into that situation. We'll always start with looking at the risk factors. It turns out that the vast majority of people who have heart disease have some sort of risk factor that contributes to it. So we're specifically talking about coronary artery disease. And there's a lot of classic ones that most people are aware of, like smoking, high blood pressure, high cholesterol, diabetes. And there's other things too, like even a family history can contribute, where there can be inherited abnormalities that make people more likely to have this disease. There's even some softer risk factors like being overweight or not being very active and eating unhealthy diets, although those often interact with the risk factors I've already listed, like high blood pressure. So we can first start by looking at all of those risk factors. And in fact, we even have some tools we can use in our computers that help us to determine what the likelihood of having coronary artery disease is for these patients just based on those risk factors alone. And that's based on studies that have been going on since the 1940s. So there's a large database of information to help with that. That's the first step. Secondly, though, we can often help be sure that patients don't have symptoms because they may have symptoms and not appreciate it. So one thing we can consider is a stress test. The idea there is we get their heart rates pushed past a certain target heart rate based on their age, and we can see if there's any hint of a circulation problem, either with an ECG or sometimes with imaging like an echocardiogram. If that test comes back normal, that helps to rule out a bad blockage, a tight narrowing that would cause symptoms. But that's still often not enough, certainly not to satisfy some of the concerns people might have about their health, because again, their friend or family member may not have had any of those symptoms or problems either. So then the question boils down to, well, you've told me maybe what my likelihood is of having coronary artery disease, but how can I be really sure? I'd like to know. And in that case, we really have to go and image those arteries. Now, the gold standard of that would be an angiogram, and that's an invasive test, usually through the wrist artery or sometimes the groin artery under local freezing and some sedation. And we get a catheter all the way back up to the heart arteries, inject dye into those arteries, and film it with a camera that shows us what the arteries look like. And with that, we can see if there's any narrowings or complete blockages in those vessels. It would be uncommon for us to consider an angiogram just to satisfy the question, do I or don't I have any kind of plaque in there, when we've already assessed the risk factors and already looked at their stress test. But we do have an alternate that's not too bad, and it's called a CT angiogram. It's a CAT scan form. So instead of the catheter going all the way through the body up to the heart, it just involves X-ray dye that's injected right in the arm through an IV. The camera can scan it at the right timing of each heartbeat and sort of stacks those images together. And although it's not as perfect as an invasive angiogram, it gives us a good idea about a couple of things. One thing we can look for is calcium. And if there is any calcium, that means there is plaque, or what we call atherosclerosis. That means coronary artery disease is indeed present. So we've answered the question, do I or don't I have plaque, if we see calcium. Then another thing it can do is give us an idea if there are narrowings. It's not as accurate as the invasive angiogram, but it can at least show us if there's sort of maybe mild plaque or moderate plaque, or even suggestive of a severe plaque. And so it helps answer those questions. So when we get to that point, then patients will often ask, okay, now we've got this information, what's next? For that, I'm going to take you to the next video in this series. So join me there.